Hi, I'm Brenda Bowler and presenting high lead levels in children's social campaign. High lead levels remain a significant public health concern with documented cases worldwide. Elevated lead levels in children can impair cognitive development, affecting their ability to learn and perform academically. Kaplowitz, 2016. Children with high lead level exposure are at a higher risk of developing behavioral and learning disabilities, which can have long-lasting effects on their education and well-being. Low-income communities often face a more significant burden of lead exposure due to housing conditions and limited access to resources for lead remediation. More facts: older homes can lead with lead-based paint are a common source of exposure, particularly in areas with aging housing. Minority communities often experience higher rates of lead exposure, reflecting broader social and economic inequality. Lead exposure rates can vary significantly by location, influenced by factors like industrial activity and lead-contaminated soil. Pelek, 2016. Lead-contaminated water is also a risk in children's health, as seen in cases like the Flint water crisis. More facts: health screening and testing disparities to have access to healthcare services can affect the timely identification and management of lead exposure in children. High lead levels in childhood can lead to severe health problems in adulthood, including cardiovascular and neurological issues. Various initiatives and programs aim to prevent lead exposure through education, outreach, and lead hazard remediation. There's policies and regulatory efforts to address lead exposure in children. Governments and social organizations implement policies and regulations to reduce lead exposure risk and protect children's health. The goals of this campaign is to inform and share informative posts, infographics, and articles about the risk and consequences of high lead levels in children, including sources of exposure and prevention of measures. We also want to change behavior. We want to encourage parents and caregivers to take proactive steps to reduce lead exposure in their homes, such as regular testing, lead-safe renovations, and safe storage of lead-containing products. We want to increase awareness about the prevalence of lead exposures in certain communities and advocate for policies and initiatives to reduce lead levels. We also want to promote lead testing kits, lead-safe home renovation services, and other products or services that can help mitigate lead exposure risk. More goals that this social campaign wants to reach: we want to create a community of parents, caregivers, and advocates concerned with lead exposure, fostering discussions, sharing experiences, and providing support and resources. We want to mobilize support for stronger regulation and policies to reduce lead exposure, encouraging followers to contact legislators and participate in awareness raising events. We also want to respond to questions, concerns, and comments from followers, providing guidance and resources related to lead exposure prevention. And finally, we want to share information about lead awareness events, screenings, or community workshops addressing the issue. Tailoring a social media campaign to these goals can help raise awareness about the health risks associated with high lead levels in children and drive positive behavior change among parents, caregivers, and the broader community. The audience that the social campaign wants to reach is parents and caregivers. Typically, these are adults ranging from 25 to 55. Consider both genders. It's primarily in areas with older housing and known lead exposure risk. Parents and caregivers are directly responsible for the health and well-being of children. making them a primary audience for information on lead exposure prevention. We also want to reach out to the low-income communities. Communities disproportionately affected by lead exposure can vary by region, but may include African American, Hispanic, or other minority groups. These are areas with a history of lead exposure disparities. Addressing the racial and social economical disparities in lead exposure is essential to promoting child health. We also want to reach healthcare professionals. These are healthcare providers, pediatricians, nurses, and public health workers, because it's crucial in screening, diagnosing, and educating parents about lead exposure risk. We also want to reach out to our local government officials. These are elected officials and policy makers in areas with lead exposure concerns. Engaging with local government can lead to policy changes and increased resources for lead remediation efforts. We also want to reach out to our educational institutions. These are school administrators, teachers, and school staff. They're communities with high lead exposure risk. Schools can be partners in lead exposure prevention by educating parents and children about the risk and precautions. And finally, we want to reach out to our community, local nonprofit, community groups, and advocacy organizations. These organizations can help get out the information. They can help organize events and advocate for lead exposure prevention measures. Targeting these groups help tailor our message and outreach efforts to those most affected by and influential in addressing high lead levels in children. The social media platforms that I'd like to use for my campaign is Facebook. Facebook allows for detailed posts, articles, and multimedia content, making it ideal for sharing comprehensive information about the risk of lead exposure in children, prevention strategies, and legislative updates. Facebook has a broad user base, including parents, caregivers, community leaders, and organizations, providing a platform to engage with diverse stakeholders. Beatowitz, 2022. I also want to address Twitter. Twitter is an excellent for quick updates, news, and sharing links to research findings and articles related to lead levels in children. It's beneficial for getting out the information in a timely manner. It attracts a broad audience, including healthcare professionals, policymakers, and advocacy groups who can play a role in lead exposure prevention and policy change. Bannon, 2023. We also want to address Instagram. Instagram visual nature makes it suitable for sharing impactful images, infographics, and personal stories related to lead exposure. Visual content can effectively convey the importance of prevention. Instagram is popular among young adults and parents, making it a valuable platform to reach those responsible for children's well-being. And then the last social media platform I'd like to use is TikTok. TikTok short form videos and creative trends can be leveraged to make lead exposure prevention engaging and shareable. It's effective for reaching a younger audience and raising awareness. TikTok is primarily used by Gen Z and millennials, making it an ideal platform for connecting with parents, caregivers, and young adults who may have children or be concerned about lead exposure. These 4 platforms offer diverse content formats and audience demographics, allowing me to tailor this social campaign to various segments of the population concerned with high lead levels in children. My timeline is a 3-month timeline into summer through the start of school. That's July, August, and September. In the first month, I would develop campaign objectives, key messages, and content themes. I would create engaging visuals. I would launch the campaign, share basic information on lead exposure, and encourage audience engagement. In the second month, I would share more in-depth content, host a live question and answer session, and promote a user-generated content campaign. I would post informative content and personal stories about lead exposure. In the last month, I would highlight actionable steps for prevention, advocate for policy changes, promote webinars or events, and I would summarize key messages, issue a call to action, and host a live wrap-up event. I would track the success of my social campaign by likes, shares, follower growth, requests for information, comments, the click-through rates, and web traffic. The metrics I would use to check on the outcome, the success of my social campaign would be engagement metrics. I would measure the number of likes on my campaign post to assess content and audience interest. I would track the number of shares on my post that I receive, indicating the reach and how well my campaign is going. I would analyze comments for sentiment, feedback, and audience engagement with my content. Mukherjee 2023. I'd monitor the increase of my social media followers throughout the campaign to gauge its ability to track and retrain an audience. I would analyze the demographics of new followers to ensure they are in line with my targeted audience. Mukherjee 2023. I would also evaluate the effectiveness of links in my posts leading to articles, resources, or events, better known as the click-through rate. I would also track the number of user-generated posts and content submissions of my campaign designated hashtag. I would assess user-generated content quality and reach to measure its impact on spreading awareness. Mukherjee 2023. I would also set up a system to log and track inquiries or requests for additional information related to lead exposure prevention. Measure engagement with campaign calls to action, such as signing petitions or attending webinars. Mukherjee 2023. And finally, I would utilize web tools such as Google to monitor website traffic data. I would utilize native analytics provided by social media platforms like Facebook, Insights, Twitter to track engagement metrics, likes, shares, comments, and follows. Mukherjee 2023. And then I would regularly review and analyze the collected data to assess that my campaign's progress and impact is making a difference. I would make data-driven decisions to optimize the campaign's effectiveness, adjusting the content as needed and the strategy as needed. Mukherjee 2023. Thank you for listening to the outline of my social campaign on high lead levels in children. These are the references that I used. Thank you for listening.